Continuing in the EMR, you can see that these other tabs over here are low lit, just indicating that there's no information under them currently, since this is a test patient. You can see here the Other Reports tab. By clicking on this tab, you'd be able to find other documents such as H&Ps or progress notes under here that you could view. Care Trends and Care Activity would list nursing documentation. You could click on these and see any interventions that the nurses have documented on. History would list your patient's history. Summary, we can click on this one. There is some information here. But here you'll be able to see a summary list. Providers that they're currently taking care of this patient. On a live patient, you'd also be able to see information such as their PCP here. This tab over here, it's not currently highlighted, this Risk Legal tab, but if there was information on this patient, you'd be able to click on it and see their consent for treatment, if they had any blood consents or surgical consents that were already scanned into the system, this is where they would be. Again, any of this information you could click on and view. Next, I'm going to come down to the problem list. So currently this patient has the medical problem of shortness of breath. Say yes, this is with this current visit. If you wanted to add problems, maybe there was more problems this patient was experiencing, click Add Problems, and you can just start to free text in what you're looking for. Select it. You see how putting a check in it has moved it up here to the top? So you could continue to add problems. Just click one, and it keeps putting them at the top. If you were done adding problems, you could just click OK, and it'll add them to the list. If you needed to add surgical problems, you could do so. There's none in here. As you can see, I was trying to expand it. But you could add problems and add surgical problems as well. If there were any family history or social history in here, you'd be able to expand these and see what was in those tabs as well. By clicking on them, you can open them up, see who entered in the problem, and generally just find more information. Maybe this was a past problem, or this is no longer a problem and you want to delete it. You can simply click Delete It, Delete Problem, and OK. Just say whatever reason. And it'll get rid of the problem from the list. If you're finished in the problems list, you can do Save and Exit, and it'll save your problems.